Canada has a high level of birth control use, but despite that, we also have a high rate of unplanned pregnancies.
We get more from our health reporter, Pauline Chan.
In Canada, just over 72% of women of reproductive age use some form of contraceptive. Condoms are the most popular, followed by birth control pills. But these methods are known to fail occasionally, and our rate of unplanned pregnancies is 265,000 every year, with 100,000 of those ending in abortion. And Dr. Dustin Kostescu says Canadians do have more reliable methods available.
LARCs are an acronym for long-acting reversible contraceptives. These are a family of birth control options that by definition you need to use or administer less than once per year.
Contraceptives such as IUDs and progestin implants.
We have seen a slow and steady increase in LARC methods. We're at about 7 to 8%, in the country, but that falls behind France, the European Union, and the UK, where you see LARC rates, closer to kind of the 20% range.
Why aren't LARCs as popular? Dr. Kostescu says many women rely on their social networks, their moms or circle of friends, who may not be as knowledgeable about IUDs or implants.
In order to have a LARC placed, in the arm or in the womb, you need access to a healthcare provider. And as we know, there's a shortage of providers.
And even if they are trained, many health providers don't do the procedure because it doesn't pay as much as other services. Unplanned pregnancies cost our healthcare system $320 million a year in prenatal care, neonatal care, as well as miscarriages and abortions. And Kostescu says families with unexpected children face additional burdens.
The cost of unintended pregnancies actually runs economically into the billions. It costs a lot of money to raise a child to 18, and most of us as parents are raising our children, and supporting them financially far beyond that.
A new report entitled Removing the Roadblocks, Policies to Improve Access to LARCs calls for increased education about LARCs and universal coverage of contraceptives.
Every health system that has implemented universal access to contraception has reaped both cost benefits as well as societal benefits by seeing great reductions in the rates of unplanned pregnancy.
He points to the UK, where he says for every dollar spent on providing contraceptives, $4 are saved in healthcare costs. Pauline Chan, CTV News.